You're next, I guess, with the COVID-19 update. Anything new to say there?
Thank you, Mr. Chair.
I think there's a
Commissioners.
lot new to say.
Nothing new to say. Any questions? No, just kidding. Thank you. I commend you, Mr. Chair and Commissioners, for your social distancing, and then you kicked off the county administrator and the county attorney, which was very wise. I'm just kidding about that. So, yes, we have a number of my staff here. We have a fair amount of information, so we'll try to get through it fairly quickly. So, just as a reminder to everyone about the governor, that stay-at-home message to help slow the spread and get the time frame for building up the hospital capacities, getting access to equipment needs like ventilators, testing equipment, planning for how we're going to care for vulnerable populations, and just to kind of get ready for further mitigation. Now, again, the stay-at-home message, just as a reminder, people can leave to do their emergency medical things that they need to do as far as appointments, medical supplies, necessary services, such as groceries, getting gasoline, those kinds of things. So essential things is what he's requesting us to be mindful of. You can still go out and do outdoor activities. We want people to get exercise and get the fresh air, and just be mindful always of that 6 foot distancing that we are harping on all the time. So that stay-at-home message is great. It's necessary for us, but just the essential things that people need to go out and get. Of course, the critical workers are exempt from that, which is public health, healthcare workers, law enforcement, the people that are working in the pharmacies, grocery stores, first responders, etc. So those are the necessary people that need to be getting to their offices and being out there to work. He did continue to close the public accommodations till May 1st. I know that creates a lot of anxiety and stress, but this virus it's still ramping up. It's a very serious thing, and some people are maybe not feeling like, maybe it's not as serious because we're not seeing a whole lot in our area, but it will continue to rise as testing continues to happen. Can you pass those out, Jamie? I've got information on our cases. And again, when we have this stay-at-home order, there's about 33 states now that have enacted that stay-at-home order. The governors have enacted that. So there's a fair number of states now that are really wanting people to be staying at home except for essential services. Jamie's passing out the information. So in Clay County, we have 576 in Minnesota. 576 cases. In Clay County, we have 6 now. Thank you. And then people that no longer need to be isolated, it's 260. So 18,822 are the number of completed tests in Minnesota in the lab, both the public health lab and some external labs. We have 10 deaths. People are dying from this illness, and then ICU, there's 24 now that are in the ICU for care, 56 that are hospitalized. You see the US cases have gone up, 164,345 confirmed, over 3,000 deaths in the United States, and close to 6,000 that have recovered. And then globally, numbers go up as well. We're almost at 800,000, almost 39,000 deaths, and then 163 almost that have recovered. So the numbers continue to climb. We're going to see that. We're going to see an increase in the next couple weeks to a month because testing is still ramping up. There's been testing in Minnesota just for the hospitalized, those in congregate care, and those with underlying health conditions. But there's a number that are not getting tested that may have mild illness, just staying at home with mild illness, and may have COVID. So we don't want to be deceived by our low numbers because we know it's community spread now. So we know that there's a number of people that have COVID-19 that are out in the community that haven't been tested. So these numbers are lower than what we would expect to see.
Have they determined how it's being spread, by contact or by airborne or?
Yeah, and Jamie will talk about that in just a minute. Thank you for that question.
Sorry for getting ahead here.
Yeah, no, that's okay. You see what's happened in New York. I guess that's on the news. That's the epicenter of the outbreak. 67,000 cases, over 1,000 deaths. That's a pretty significant number, and I know the governor has now reached out to all healthcare workers. They really are short healthcare workers. Those frontline workers are critical, and they also have that mobile hospital, that hospital ship that arrived there to help with the strain. So if you look at what's happening in New York, you see how serious this can get. So the virus will continue to ramp up. We have not seen the peak yet. We won't know when we see the peak. It changes every day. We're getting new information about this. So we know it's going to get worse before it gets better. And we also know that the prediction is, like almost all viruses, it will peak and then we'll see a decline, but it will ramp up. The prediction is in the fall again. We'll see another increase in this. And that's again, it's hard to predict exact about what is going to happen because it's a virus. So it's kind of as they're studying it day to day, we're getting more information. But we do know it is going to get worse, and it's going to be a number of weeks to a month before we see any changes in improvement. And then I think, Jamie, you can take it from there.
Is this one working?
Thank you. I think that's working.
Okay, well, I'm going to start with doing some highlights and just talk a little bit about long-term care. Public health is charged with protecting the health of the public with an emphasis on the most vulnerable populations. And so part of what we're doing right now is working with our community and partners on congregate care and long-term care facilities. We have 25 long-term care facilities in Minnesota that currently have outbreaks. In those facilities, there are 21 residents that have been affected by COVID, and 11 of those are healthcare workers. So there are about 375 long-term care facilities in Minnesota. So really that is what we're focusing on, because the most vulnerable, the people that it is most deadly for, are those over age 80. And so I'm going to just kind of review some of the things that we've talked about previously about what we can do to control that. Again, our facilities are working diligently in protecting the vulnerable populations, but flu and coronavirus are both spread in the same way, so that's your question. The droplets from the cough can spread 3 to 5 feet, which is why we're saying stay 6 feet from each other. So that's the best way we can protect each other, is to stay that 6 feet apart. It is that coughing and sneezing is how it's being spread from a person who's ill and symptomatic to another person in the air. The other thing we've talked about is the surfaces, and there's a lot of discussion about surfaces, and the best way we can protect ourselves is to wash our hands before we prepare food, before we put our hands in our mouth, nose, and eyes. And so that's really going always back to that's how we can prevent that spread from surfaces. The average coronavirus patient can infect 2 to 2.5 people, which makes it more contagious than flu. People over the age 80, as I said, it's the most deadly for people over the age 80. 5 to 10 times more deadly than flu coronavirus is for an individual from 0 to 45. And it's 12.5% more deadly for a person who's over the age of 85. So again, it is more contagious than flu, but I think we need to remember that it can also affect all of us, and the best way we can protect our total population is by keeping our distance and following the guidance. An estimated 17% of cases are asymptomatic. There's One thing we've talked about with this disease is we're constantly learning new information. What we hear in the media, we have to go back to CDC and MDH to see kind of the fact checked and what do they know for sure. There is a lot that they're still learning, but they are thinking that it is very low transmission if that person is asymptomatic, but that's kind of the newest from CDC as of yesterday. If you have symptoms, you can manage them at home. You do not need to seek health care, and you do not need to be tested. If you're an older person or a person with underlying health care conditions and you're ill, you probably want to reach out to your provider to see if they have any other recommendations for you. The most important thing is to stay rested and to stay hydrated if you're caring for yourself at home. Then there are precautions for protecting others in the environment that you're living in as well, as I mentioned earlier. Some of the COVID symptoms get worse about towards the end of the second week, and that's when you may want to seek health care. If you do, call 911. It's important that you call in advance. When you call, let them know that you are experiencing symptoms. Dispatchers will ask those questions, but let them know anything that you have communicated with your provider. If you have been tested, if you were told to stay home, those are things you'd want to share with 911 dispatchers. Let's see. CDC has not changed their recommendation on wearing masks for the general public. There's a lot of discussion about masks. In order to be fully protected, you need a mask that's fit tested for you, which means that you've been tested to make sure the seal is good on your face. You also need eye protection because, again, that coughing and sneezing is spread. The droplets can land in your eyes, in your mouth, and so that's the best way to be protected. The best way that the public can protect themselves is the 6-foot social distancing. There's a lot of information out there about preparing masks, making masks, and it is better than nothing is basically, but it is also more important that we maintain that social distancing. And that's about it.
Is there any type, I mean, you say isolate yourself. There's no treatments then available or any type of medication that they've come up yet that's going to help?
Not at this time. As you've probably heard, there's a lot of things being tested and discussed, but at this time, the only treatment is to rest and to keep yourself hydrated unless you need emergency care.
I guess the other thing that you mentioned, that if a person feels that they do have it and they have some symptoms, to call 911, is that the procedure we want?
No, and really you want to just manage your symptoms at home. Unless you are an elderly person or have a chronic health condition and are ill, you may want to reach out to your doctor to see if they have any special instructions. But the only time you want to call 911 is if you are not able to manage your health. It's an emergency situation at home.
Okay. I guess I heard that wrong. You know, I
Sorry.
thought we were supposed to call 911. All right, very good. Any other questions for me? Go ahead.
Yeah, thank you. Kathy, I think some of my questions that I have, I'm kind of relaying from citizens that have contacted me. Number one, I received some information from an old high school classmate of mine who ended up being a infectious manager for Sanford for her entire life until she recently retired. And she had sent me something here, and maybe you can jot this down, because when you look in social media, the statistics and the projected deaths and everything, they're all over the board. There was one place in Minnesota where I saw where they were anticipating 500,000 deaths. I don't mean to laugh at that, so she had told me of a website to go to that she felt was giving out really good information, and that website was healthdata.org. I don't know if you've heard of that one or not, but it breaks down, and what they've done is and it's done by Washington University, and they broke it down by state. They broke it down to from beds, hospital beds, beds available, beds needed for when they anticipate the peak of these things in each state. And they also did an inventory by state as far as ICU beds and what they anticipate for ICU beds, and it gets into the ventilators and all of that stuff. And I was able to go onto that site, and I was pretty impressed. Again, it's, who do you believe? But I think, and the reason that I felt confident in that is because it came from somebody who's worked in that for a long time. So, she did say that she was involved with H1N1, she was involved with AIDS and all of these things a lot of these things in her 30-some years in that position. And she did say that she's seen nothing like this one in terms of what you talked about, the infection rate. So people do need to take it serious. So I just wanted to point that out, and maybe you can look at that. And it also then gave for each state when they anticipate the peak to be. And I think in Minnesota, that peak is mid to late April. That's what they're showing right now. But who knows? But and then I've gotten a lot of feedback about still a lot of social gatherings going on. And I had a communication from somebody last night that they were out for a walk, and in somebody's driveway there were 30 to 40 people having a little beer party. And Gabe, this is kind of one of the things that I wanted you to hear about this. And my first question was, are they staying 6 feet apart? So that can play a part of it. And then they said that while they were doing that, all their kids were in the backyard playing together. And that's scary. I don't know that people are, I think you mentioned, I don't know if we're taking this serious enough yet in regard to the ability to transfer that virus. And then just this morning, somebody contacted me about, apparently there's been some research done by mapping from cell phones. Have you heard of this at all? And Gabe, you have?
I think they put some data out last week.
Yeah, so.
Minnesota, the letter grade.
Yeah, and just this morning I see where, from a cell phone standpoint, every state was given a letter grade, and it was even went down to by county. And again, that they were being able to tell who was moving around. And the state of Minnesota got a C-, and Clay County got a C- in this. And that, and again, I want to tell you the source that was given to me so you can check it. And that was Matador, MATADOR network.com. Put that out. But and again, I think if, there may be some indication that that's right, but of course, some of those people might be the exact people that are supposed to be moving around too.
One thing to keep in mind too is we've got the interstate running through, so it's taking cell phone data as it bounces off the towers. So we still have a lot of interstate traffic. I-29, even people on I-29
Sure.
might be bouncing off our towers.
Okay.
So some of it's maybe a little skewed, but.
Okay, well that's good to know. That's, those are the comments that I wanted to make, and I think anybody who's probably not taking this serious probably should be doing some rethinking right now. Those are my comments.
Thank you, Commissioner Campbell. And I think sometimes when you talk about the people standing out, a crowd of people, for some reason they think they're outside. So maybe that's okay to stand closer together, but that is not the case. As Jamie described, that the spread can be 3 to 5 feet, whether you're indoors or outdoors. So that 6-foot distancing is just as important outdoors as it is indoors. So yes, I would caution the community again to just, this is a serious virus, more serious than we've ever experienced. And so we need to really heed the warnings. And when we're feeling like we're doing enough mitigation, or maybe even more than we should, it might not even be enough. So we have to keep that in mind that, you know, as difficult as this is, to close, you know, public accommodations, gyms and restaurants and bars, it's a necessity, so we don't see such a massive, or trying to slow the spread and see less people infecting each other. So that's very important. We do have two other of my team that have a few things to talk about. Rory Beal, Health Promotion Director, and Josh Ebert is our Public Health Emergency Preparedness Coordinator. So I just want to thank my team, this incident command team, you know, they're doing a lot of work. There's so much to kind of get through and cover for public health, because this is a pandemic, it's public health led. So I appreciate the team, I appreciate all of the public health staff that have, some have taken on extra duties, like our public information officers. And then all the staff, they're working to try to keep up with their clients and meeting the needs that we typically have to do. But it's a huge undertaking. We also have great partners. You know, Gabe obviously is a key partner. We have some social services staff. We have Chad that comes to our briefings. Chad is the Moorhead City Emergency Manager. So great partners. We have a great team, and so I appreciate all the work that everyone's doing. So I'll turn it over to Rory and Josh.
Sure, that's fine. Good morning, board, and everyone watching. I just wanted to, Kathy asked me to just expand a little bit on what's going on around the state in Minnesota for planning, expanding our hospital capacity. And so I'll just give a few comments on that. There's a lot of work going on at the state level, of course. I believe that the state of Minnesota is taking a really proactive approach to this, which is great to see. They're trying to get ahead of this, and of course the time that's been given during this executive orders that are in place are giving them an opportunity to plan for the peak on this. So real quickly, in this week and in the next week, Joe Kelly, who is the Director of Emergency Management, Homeland Security, has been given the undertaking to look at alternative care sites around the state that could be used for care. And what those are is an alternative care site is obviously alternative to a hospital setting. And so the idea is to leave those spaces in the hospital for the most critical, those that are being affected by COVID, and then those that are not in need of such intensive care could be basically outsourced to an alternative care site for their follow-up care. An example that was given, somebody breaks an arm, they go in, they get their surgery, whatever it is. In the healing process, they could be then placed in one of these alternative care sites. So they broke the state down into their different respective regions and are looking at sites in each region. Gabe is working with Homeland Security, Emergency Management on that process, and so he's keeping me in the loop on that, and there's some discussions across the border too on how that's going to look within our community. But as of Sunday night, there were 255 intensive care unit beds available across Minnesota. That was a 30% increase in the last 2 weeks. There are now 1,250 available ventilators statewide. That's a 56% increase in the availability. The total number of hospital beds in Minnesota currently stands at 2,621 as of Sunday night. The state officials are anticipating they can increase the number of available beds to more than 5,000 through alternative care site facilities. And again, the effort's being undertaken by the State Emergency Operations Center, or through them. They're going to be flying around the state this week, sounds like in even Blackhawks, to do these site evaluations and look at these potential sites. So I'm sure that they're in contact with Gabe on that as that takes place and what might happen with that. And of course, as you can imagine, and you were talking, Kevin, a little bit ago about, you know, this peak and all that, and there's some of the factors that go into play here, like supplies. I mean, there has to be supplies to you know, support these efforts. So there's a lot going on trying to navigate that. You know, how do we get the right supplies here? Is it going to be timely in combination with all these sites that are, of course, resource intensive? Takes a lot to get these stood up, and then you gotta supply them and resource them. So it'll be interesting to see how it all shakes out. It's an adventure for sure. I just want to reiterate what Kathy was saying. The partnerships and the relationships that we have, it's a team effort, and I can't say thank you enough to Gabe, the emergency manager, for supporting us, and Chad Stengel too from the city of Moorhead. It's been invaluable, so thank you for that.
Good morning. We have, in public health, we have an obligation to help homeless folks who have been infected or have the symptoms of COVID-19. And so we have been working with our local shelter and some facilities in town to develop a plan for temporary isolated housing. And so this would be for folks who have a positive test, those who have had close contact with somebody who has, and those who have the symptoms. And so that work, the devil's in the details. We've been working with a number of agencies about if we do have a facility, laundry and food and cleaning and all of the details that are going to be really important to I guess, have in order. Last week we submitted a grant application to MDH to help us fund this, and we have not heard. It's expected to be a quick turnaround, so I think any time now we'll know. If we don't get that funding, these would be additional county expenses that we would need to undertake, and then hopefully be reimbursed as part of this emergency declaration. So that's something that I guess we're continuing to work through the details of, but we anticipate that our homeless population that's living in congregated care, there's 112 folks that they have each night at Churches United, and there is not a way to isolate folks in that facility. And so we think it's inevitable. We're trying to get ahead of this so we can have a way to isolate and provide some temporary housing. And we've been in contact with MDH and communicating with several other counties to look to see what they're doing and trying to build the best model that we can in Clay County to address this.
Any questions for them? Just a few comments. Thinking as we go along here, I look at the schoolyards. I don't know who's policing schoolyards or stuff like that. I mean, is the school supposed to be doing that, or is the police? Because I mean, right now the kids are all at home, and when it's warming up now, they're all going to be out playing, and they're gathering at the schoolyards. Are they closed down, or do we have any perception of that, or do we know who's controlling that?
You know, there's no, I don't think there would be any enforcement action taken. Obviously, it would come down to parents making good decisions. You know, they put in this social distancing and stay at home. Again, the governor's encouraging people to get outdoor activity. That would fall on parents and guardians to tell their children, you know, okay, you two can go play, don't be in a big group. That there isn't, I don't think playgrounds should be closed down, and schools aren't necessarily closing them down. But it's up to parents and guardians to make the right choice for their kids.
Another, as far as commission, I don't know whether we got to make some decisions here or not either. You know, we got the thing of not having 10 or more people in a gathering, something like that, and I look at, there's 15 of us here today making decisions here, and you're not supposed to have gatherings of 10 or more. I mean, do we as a commission have to do something that we have to do do it by off-site, like some of the places are doing? I don't know if we have to go to that area yet or not.
Mr. Chair, thanks for bringing that up. I think that definitely is something this board should think about, as all other city and county governments are considering that. The 10 or less is the recommendation in order to stay 6 feet apart. So that's certainly, I appreciate that you're social distancing now, 6 feet apart. So that's certainly a consideration of how many you want in the boardroom.
Okay. I guess it's sort of a personal decision whether we as commissioners want to come to the meeting or not, you know. And I know Jenny's doing it from home, and it's working out, so I don't know if we're going to make any changes or not. if there's any recommendations to make changes, or whether we have to or not, so.
Mr. Chair, one of the ways maybe we could do this would be to, as we have on our agenda, we have time slots, you know, for each item, and maybe for those who have a time slot to be here for that time slot, and then, you know, those that there's no need for some to come here at 8:30 if your time slot is 9:30. That could maybe help keep this down. But you know, obviously what we're seeing in this room right now, everybody is 6 feet away, and you know, I think we're meeting that. Although we have more than 10, but the room's big enough, I think. But
Okay. I just wonder if anybody's concerned about making changes to that. That will go on as we have been. Okay, anything else, Kathy?
Yes, just one more thing. We have, Commissioner Haney and myself were part of that Wednesday media briefing that is held over in Fargo. My public information officers are in touch with the information officers across the river as well. We suspect it's going to continue every Wednesday, so I don't know if our county administrator had mentioned that, but we'll want someone there from this board, as well as myself, to again do a presentation. My public information officers are writing scripts right now, so I think it will be the same time. They're verifying the time. I think it was 11 when we went last week, and Commissioner Haney did an excellent job. We had all the mayors from all the communities as well as others there, so I think there was 10 of us. So we will continue, as far as I know, to do that every Wednesday, so.
Okay.
Mr. Chair, if I can, one last thing. In your presentation, let's see, about the beds in Minnesota, you know, I think one of the things that's for Clay County and Moorhead, the likely bed place for them isn't even gonna be in Minnesota. It's gonna be in
Right.
North Dakota, it's gonna be in Fargo. And you know, so, I don't know if we have the ability to take a look at, and I think, I saw a deal on television where they had the leaders of Sanford, Essentia, and Altru, and they talked about the total number of beds and what they anticipate, and I think for Clay County, you know, we can look at the Minnesota statistics for beds and everything, but I think it's important that we, you know, we see where the likelihood of our people going, and what those numbers are to support getting, you know, all of the things that would be needed for the facilities that our people are going to be using.
Yes, that's correct, and we do have a COVID task force, so it's all the health facilities, public health, there's some officials on there, schools, so they will regularly update us, our health facilities in North Dakota, about that.
Okay, any further comments?